Is there really a minimum age for facelift surgery? Well, theoretically, possibly 18. However, we have to be also very realistic. Who needs a facelift at the age of 18? Now, this is for beautification purposes or for rejuvenative purposes. No 18-year-old needs rejuvenation. However, if you have had an accident, which I have seen cases, and what we call degloving, sorry for being so gruesome, but with the accident, basically the face slid off and sits lower than the other side. These could be indications for young patients of a facelift, more so for reconstructive purposes. Now fast forward into your late 20s, early 30s, some patients might have heavy sitting, low set facial fat tissue that needs to be repositioned. And these would be cases of younger patients in their 30s and early 40s that can have a deep plane facelift just to create a look that looks more balanced. And then also there are patients that have like the very first signs of aging and they say like, why should I wait 10 years or maybe 5 years until it looks way worse? Let's just be ahead of the curve. Let's get started now, because you can have another facelift and a deep plane facelift, revision facelift in a couple of years, in 10-15 years. So it's not like a one-off that you have once in your lifetime. So those patients that say, I enjoy how I look, I realized in the last 2 or 3 years that changes started happening because of aging. Let's take care of these right now. You do a deep plane facelift. You don't have to be overly aggressive. You don't necessarily need to do a lip lift and a brow lift at the same time. You just do this, and then you can enjoy the appearance for another decade or 15 years. And then also there are patients that feel like, you know what, I just want to get it done when I'm ready. And then the longer you wait, the more likely it is that adjunctive procedures need to be combined, because it's not just the cheeks that are descending, it's the neck that is aging, the cheeks are descending, your brows are descending, skin on the upper eyelids is getting fuller, the lip is dropping. So it's not unusual, the longer you wait, to do a combination of several procedures to refresh everything, because guess what? Your face ages. It's not just the cheek that descends because she decided to be a bully in your face.